There's a lot of CIOs listening to this, others in informatics and IT. And most of us don't really feel like we have power to intervene on how much energy the hospital is using. But what are some of the things that you've seen or you've seen others do to intervene from, I guess, an IT perspective?
So I think the connection to informatics is not immediately obvious, but as you start to dig into it, you realize that there's a lot that informaticians have to offer in addressing climate change from both the adaptation side of how people and communities respond to health disasters from climate, as well as the mitigation side of how we can reduce our health system's impact. Because if you think about it, what informatics professionals are really good at is we're really good at being able to break a problem down into measurable, quantifiable chunks. We're able to then drive behavior change and nudges through standardized processes that are scaled. One of the initiatives that is going on right now across many health systems and has been identified by IHI, or the Institute for Healthcare Improvement, as a key target area for intervention is to reconsider the use of metered dose inhalers for patients with asthma. Metered dose inhalers, the asthma inhalers that have the gas propellant, actually are significant greenhouse gas contributors. Some studies actually estimate meter dose inhaler prescriptions to be 3% of a hospital or healthcare system's greenhouse gas footprint. And so, if you want to think about an intervention to change the prescription of meter dose inhalers to dry powder inhalers, there are a number of informatics considerations at play. So there may be an opportunity for having a clinical decision support system or alert that might alert a primary care physician, a pulmonologist who's prescribing an inhaler to consider a greener choice. Just like on Google Maps, when you get an option with a green leaf, and that's the more fuel efficient route or the greener route. And so I actually currently have a seed grant exploring this at Stanford, looking at how we might take some of these sustainable care choices and consider them as clinical decision support interventions that could be integrated into the EHR. The one other thing too I'll say here on this, just on the subject of where informatics plays a key role, to be able to measure and quantify a healthcare system or hospital's
Yeah.
impact reducing greenhouse gas emissions, there's a huge role for quantification to build dashboards to be able to show people across the healthcare system how we're achieving some of these goals that health systems are setting.